Good afternoon. My name is Jim Johnson. I am a professor of strategy and entrepreneurship in the Kenan-Flagler Business School at UNC Chapel Hill. I am delighted to be with you this afternoon to share a few thoughts. I'm a business demographer by training, and I want to share a few thoughts with you on the impact of COVID-19 on North Carolina's demography. Talk about the data that I'm drawing upon today and sharing with you is from the post-2020 census population estimates for the period April 1st, 2020 to July 1st, 2021, which covers the first 15 months of the pandemic. And so the crucial issue is what happened to our state and nation during the pandemic. I want to talk about three big trends at a high level today. I think our population was moving and grooving. I think our population was browning and graying, and our population was rebelling and disappearing. Let's talk first about moving and grooving. The real big key takeaway from the pandemic is that the South was the place that experienced the most rapid growth during the period. As you can see in this graphic, the South for that first 15 months of the pandemic grew by about 959,000 people, close to 1 million people. The Northeast lost close to 500,000. The Midwest lost 144,000, and the far West was growing pretty slowly at about 78,000 people. So the trend that we observed for the last 3 or 4 decades, with the South being the place, I often talk about the South rises again, that continued during the pandemic, if you will. And all of that 959,000 people that we experienced growth in the South was driven by migration for the most part. Our population can grow for 2 reasons: excess of births over deaths, natural change, more people moving in than are moving out. As you can see in this graphic, 94% of that 959,000 people were newcomers, migrants. I call them pandemic refugees entering our state. When you look at the growth, you see that profound redistribution of population from the Northeast and the Midwest, both of which were losing population. Incredible growth in the South, but North Carolina grew even more rapidly than the nation as a whole and the South. We posted a 1.1% growth rate in that 15 months, adding about 112,000 people to the population of the state of North Carolina. So while the South was the primary region for growth and destination of pandemic refugees, North Carolina grew even more rapidly as a function of the relocation trend. And if you look at this graphic, the right-hand side, what you will see that North Carolina was the 4th most attractive migration destination during the pandemic. Every day for that 15 months, we got a net of about 253 newcomers arriving in the state during the pandemic. All of those pandemic refugees fleeing major urban centers, a substantial number of them were arriving in North Carolina, behind the numbers that arrived in Florida, Texas, and Arizona. We were the 4th most attractive migration destination during that period. And if you look at the left-hand side of this graphic, what you will see is that California was losing 923 people every day. New York was losing 861 people every day. Illinois was losing about 324 people every day. You can go down the list and see the rest of the states that were losing population. Many of those people, a lot of them ended up in North Carolina, profoundly changing the complexion and size and composition of our population. Again, the 4th most popular migration destination, 100% of our growth driven by migration during this period, dramatically transforming our population in the state of North Carolina. Prior to the pandemic and the decade 2010 to 2020, about 15 counties in North Carolina captured the majority of the growth that we experienced during the second decade of the new millennium. If you look at this graphic, what you will see is that a much broader set of counties captured the majority of the growth, whereas two counties in the decade of 2010 to 2020, Wake and Mecklenburg, captured about half of net population growth. What you will see is an expanded growth pattern, with about 6 counties capturing about 50% of growth, 15 counties capturing about 74% of net growth, and 26 counties capturing about 80% of growth. So we had so many people arriving here, and those original migration destinations became overgrown, if you will. Wasn't that much more land to expand and develop, and the cost of living was going up in those places. And so surrounding counties, suburban counties and exurban counties began to grow pretty rapidly, expanding the list of migration magnet counties from about 15 during the previous decade to about 26 counties during the first 15 months of the pandemic. Where was those growth poles? You can see them here. The orange circles refer to the metropolitan destinations of pandemic refugees, and the triangles coincide with amenity-rich micropolitan destinations, Pinehurst, Albemarle, Morehead City on the East Coast. But you see the urban crescent, and you see the amenity-rich places in the mountains and on the coast that were growing dramatically during the pandemic as people fled major urban centers for other places. If you look at the 17 real estate markets on this graphic here, what you will see as, again, North Carolina, 253 migrants every day. The Raleigh market got about 62 migrants every day. The Charlotte market, about 53 migrants every day. The Myrtle Beach part of that's Brunswick County got about 20 people every day. Winston-Salem, about 15. Wilmington, 12. Asheville, 13. You can go down the list and you see the remaining markets got between 2 and 8 newcomers every day, transforming the composition of those communities and the real estate markets. And so this is a profound kind of change in the North Carolina experience. What distinguishes the pandemic era, the first 15 months of the pandemic, from the earlier period, as I indicated earlier, much of the growth was concentrated in Mecklenburg County and Charlotte and the central counties in just about all of the metropolitan areas. During the pandemic, we saw rapid growth and an increasing share of the population growth in the surrounding counties. In fact, what we know now is that both Durham and Charlotte, they experienced net out migration during the pandemic, where much of all of the growth was in the surrounding counties, probably related to the rising cost of housing in those markets, the restricted amount of additional undeveloped land to continue to grow. And so the suburban counties and exurban counties were growing rapidly in those multi-county metropolitan areas. So suburbanization, decentralization of population characterized the pandemic era, or at least the first 15 months. At the same time that we were a migration destination, the 4th most attractive place, and a continuing spread of population beyond those migration magnets of the 2010-2020 period, our population also continued to diversify during the period. One of the interesting things that happened during the 2010-2020 period, for the first time in history, the non-Hispanic white population declined by 5.1 million people. That decline continued during the first 15 months of the pandemic. If you look at the left-hand graphic here, what you will see is that the white population in the United States declined by about 1.1 million. What that means, of the 444,000 people that we added to the US population during the pandemic, 100% of that growth occurred among people of color, led by Hispanics, whose population grew by 936,000, led by Asians, whose populations grew by 200 218,000, and people of mixed race, two or more race, grew by 208,000. The African American population, 154,000 net gain, and the American Indian Alaska Native by 9,100. So that growth offset the growth of the loss in white population, leading to a net growth of about 444,000 people. That's what we call the browning of America, that those people of color driving change. North Carolina, if you look at the right-hand side of the graphic, did not lose white population or did not end up in white population decline. White population grew by about 31,000, but that was about 28% of the total growth. So again, about 3/4 of net growth driven by people of color, the same kind of trend that we observed nationally with Hispanics, Asians, African Americans, Alaska Natives, and the mixed race population driving growth. So our markets are becoming far more diverse as a function of the kind of change. This is a continuation of a trend that we observed during the preceding decade of the browning of America. At the same time, the population was graying. As you can see, looking at the United States, the most rapidly growing population during the pandemic was the sole source of growth really for the US population was the 65 plus population, increasing by about 1.7 million. Both the under 18 population decline and the 18 to 64-year-old population decline. This is a huge issue for us because it speaks to a labor market challenge that we have. Where is the workforce going to come from if we have declining growth or population decline in both the under 18 population and the 18 to 64 population? Fortunately for North Carolina, the 18 to 64 population grew during the pandemic, but it was pretty slow growth. Again, the greatest growth occurred in the 65 plus population, in part because the state is a major retirement destination. And for both people who are already retired and people who are contemplating retirement, many of them have children and grandchildren in the state of North Carolina, and they're voting with their feet. And they did so during the pandemic to be closer to their children and grandchildren and the like. And so this issue about meeting demands and workforce demands moving forward with a slow growing and a 18 to 64 working age population, and the pipeline behind it, the under 18 population actually declining. The reason for that decline is below replacement level fertility. We've had below replacement level fertility ever since 2008, and during the pandemic, it didn't get any better. We actually lost even greater population, as you can see. We're browning and graying. We're the destination for people coming in, and we've experienced decentralized growth from the major population magnets. We're also, during the pandemic, we saw a lot of rebelling and disappearing of population. You heard a lot about the Great Resignation. One of the things that CEOs talked about a lot in a survey was the challenge that they had with labor shortages. 73% of CEOs surveyed by Fortune, about 117 of them said they faced labor shortages. They had problems attracting and recruiting talent, 57% of them, and 51% said they had problems retaining talent during the pandemic. Why? Because we saw this growing labor activism, something we hadn't seen in our economy and society for 2 or 3 decades. And what we know is that women and people of color were fired up for change. On lockdown, lots of people began to reflect on their lives, their family circumstance, their work environments, and the like. And the research shows that about 4 out of 10 people wanted to change jobs during the pandemic. Why did they want to change jobs? 36% of them wanted better compensation and corporate benefits. 25% of them wanted better work-life balance. 16% lacked recognition for their work. 8% to find better corporate culture, and 5% said that company's values didn't align with theirs, and another 5% said that They liked a strong relationship with their peers and the organizations that they were working in. And a 5% said they don't know why they want to change jobs, but they wanted to be out of the job that they were in. And so this notion of an enormous turnover in the workplace called the Great Resignation was part of that rebelling in terms of the current circumstances around the world of work and how people felt about the places that they worked vis-a-vis their own family and personal lives. At the same time, in terms of rebelling, and there were, in addition to rebelling, there was a population, lots of deaths during the pandemic. And if we look at the statistics, what we know is that the COVID pandemic reduced life expectancy among all races by about 1.1 years. Among whites, it reduced life expectancy about 0.7 of a year, but among Latinos and African Americans, you see major reductions in life expectancy of 3 and 2 years, respectively. This is what undergirds all of the questions about the disparate impact of the pandemic on people of color. It has enormous implications moving down the road for the demand for housing, for the workforce, and the health and well-being of the people we have to tap into for work moving forward. Probably one of the biggest aspects of disappearing was the adverse impact that the pandemic had on drug overdose deaths. They soared during the pandemic. During the first year, drug overdose deaths, they're called deaths of depression due to suicide, alcohol, and drug abuse. There were about 90,000 of them in 2020, about a 30% increase over the 2019 death toll. One expert said it's the biggest increase in deaths in the history of the United States. The issue was far too many people who were struggling with drug addiction were forced into isolation and didn't have access to in-person drug treatment and counseling, and that proved to be deadly. It increased well over 100,000 about a year later from those earlier statistics, and from mid-20 to mid-2021, about 100,000 people died of drug overdoses and the like. And understand that these are people who are prime working age people for the most part, usually 24 to 45 age range. Sometimes it's younger than that now, but these are people that we're going to need to pay into the Social Security system, buy houses and all other kinds of consumer goods and services, and propel our nation and our economy, but they're dying much too early. If you look at the statistics for North Carolina, opioid statistics, which and we're comparing 2019 prior to the pandemic with 2021, about 15 months into the pandemic, and what you will see over that period, there was a 59, close to a 60% increase in deaths, an increase of 1,407 deaths during that period due to opioid abuse. The emergency room department increased by 29%, from about 12,000 hospitalizations to about 15,000, an increase of about 3,596 hospitalizations, and a 40% increase in the naloxone reversals. That is bringing people back to life. We did that. The increase was about 1,194 people. Again, these are prime working age individuals that we need to be healthy and contributing in our society moving forward. The other thing that I think is our challenge out of the pandemic is, yes, we had about 26 counties that benefited in terms of growth and development, but we also had a large number of counties who have been left behind in that whole process. This is a group of counties, about 9 of them, that experienced biological population decline during the pandemic. What does that mean? Yes, they had more people move into the county than to leave the county, but they had more deaths than they did have births, and the excess deaths outweighed by a long shot the number of people coming in. They were biologically declining populations in these communities, and if you see that they lost about 1,157 people collectively because 2,676 more deaths than there were births in those communities. While you had 1,500 people moving in, there were just far more deaths than births. So that's a biological decline. And these are counties that are left behind. And the question is, what do we do about that moving forward? Even more startling, we had another group of counties, about 17 of them, that deaths exceeded births and out-migration exceeded in-migration. When those two things align, when there are more deaths than there are births and more people leave a place than move there, you are literally a dying county. And as you can see, that these counties lost, there were 2,868 more deaths than there were births, and 2,296 more people left the counties than moved into the counties, resulting in a population loss of about 5,164 people. These are those counties where hospitals are closing or at risk of closing, where disinvestment is the order of the day, where there's lack of broadband access and a whole range of other things. These are the kinds of places that we're going to have to focus on in terms of development moving forward. The thing that I didn't talk about is that in the beauty of having large numbers of people migrate to our state, many of them brought a migration dividend with them in terms of their incomes and ability to buy housing. So it drove up the price of housing. What we have is a housing affordability crisis, and probably the biggest crisis in the population growth magnets is the situation that exists now is that we have priced out of the market the very people who are hired to protect public health and safety and educate our kids: police officers, fire personnel, EMS workers, nurses, and public school teachers. We have to figure out how to do a better job on workforce housing in these environments. And given the large number of people who are 65 or older who are migrating to our state, and the number of people who are aging in place, we need to think in real estate terms about age-friendly housing and community development to ensure that there's equal opportunity of access and mobility in our communities and in our housing. We don't have time to talk about it today, but the real challenge moving forward is we're in an era of slowing total population growth. In the first 15 months of the pandemic, we had the slowest rate of growth in our history, and for the first time, and since the census has been gathered, it's the first time that the population has increased in a 12-month period by less than 1 million people. We only grew by 444,000. I worry a lot about the potential for climate migration. Will many of these people who are pandemic refugees who settled in our states, many of those places that they've settled in are vulnerable to adverse weather events? Will we see a subsequent climate migration, and what are the consequences of that? We need to think about how do we figure out how to deal with deaths of despair, because those are prime working age people that we're going to need to propel our state and future growth, particularly given the large number of successes we've had in recruiting major industries to our state. We need that talent to drive the workforce. Declining fertility is an issue because we need a pipeline of young talent to continue to propel our growth. And how do we figure out how to incentivize growth in these declining counties? How do we incent, like we incent businesses to locate in some communities? How do we incent people to relocate to our declining communities? Because we're only as strong as our weakest link. Thank you very much for your attention. I'm happy to entertain questions if there are any. Someone wants to know if they can share a screenshot of the presentation. Absolutely. Okay, thank you very much.